Good morning, and welcome to the Choking and Airway Obstruction for Individuals with Intellectual and Developmental Disabilities. This training is being conducted today with nurses from the Office of Integrated Health Supports Network at the Virginia Department of Behavioral Health and Developmental Services. Today we have
Okay. Hey, yeah.
Shh, 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 shh. Hey, if everybody could please put their mic on mute, please. Sorry, Melissa. Melissa, you're on mute.
Today, we're going to be discussing choking and airway obstruction for individuals with intellectual and developmental disabilities. This training is being presented today from the Office of Integrated Health and Health Supports Networks at Virginia Department of Behavioral Health and Developmental Services. We're going to be tag teaming this training today. So first, you will hear from Christine Kocher, who is the Region 5 Registered Nurse Care Consultant, and myself, Melissa Blevins, who is the Region 3 Registered Nurse Care Consultant, and then also Roxanne Lawrence, who's located in Region 4. So to begin our training today, I'm going to turn it over to Christine Kocher, and please note that the training slide deck will be available at some point. It will be posted, so we know that that is a big question for everyone. It will be available. We will also provide a training certificate for those who complete the survey at the end of the training. And also, we ask that you keep your microphone on mute just to cut down on the number of distractions. So please just sit back and listen, and I'm going to turn it over to my colleague, Christine.
Thank you, Melissa. And we'll start with some learning objectives. The program here will cover most of these items so that at the end you should have confidence in identifying leading risks, factors, and conditions which increase choking risk. You'll be able to identify signs and symptoms of difficult or impaired swallowing, referred to as dysphagia. Name 5 foods that increase choking risk. Describe steps to take when a screening tool indicates an increased choking risk. You'll describe whom to seek help with when symptoms of dysphagia are observed. You'll describe the role of a speech-language pathologist, referred to as SLP, and why ongoing monitoring is needed for those with dysphagia or increased choking risk. We'll also look at identifying tests used to diagnose dysphagia, and describe and identify different types of modified diets. Describe 2 types of protocols that can be used to reduce choking risk. Describe steps to take in situations in which dignity of risk intersect with an individual's food choices. We'll also look at how we can demonstrate the universal choking sign and describe the steps to take during and after a choking event. We're going to complete 1 case study, which will also locate and utilize educational resources about choking from OIH. Next, we're going to just look at the swallowing process and a definition of choking. Next, the infographs here show normal swallowing and what happens when there's dysfunctional swallowing. The normal swallowing and breathing are seamlessly coordinated. Individuals with any type of brain or nervous system or muscular dysfunction are at a higher risk for swallowing problems. And during the normal swallowing process, the vocal cords cover the airway during swallowing, so foods and liquids travel from the stomach and down the trachea into the lungs. When someone is experiencing impaired swallowing, the vocal cords may not cover the airway completely, and this allows food and liquids to travel into the lungs, causing aspiration. Next. If food gets stuck in the upper esophagus, the tube leading to the stomach, it can block the airway. You also hear it called the windpipe trachea, causing an individual to choke because they cannot breathe. Choking is defined as an obstructive, blocked airway. Choking can be caused by an object such as a toy, battery, coin, could be fully or partially blocking the airway, and also food or contamination of food, or excuse me, combination of food and liquid blocking the airway. So hopefully these pictures are helpful to make this clear. Next, we're gonna maybe see what happens here. Choking can happen to anyone and is always an emergency situation. Brain damage occurs within 4 to 6 minutes when breathing ceases. So if nothing is done immediately to dislodge the object from the airway, death will always occur. So even if you think you are not highly skilled at saving someone, it is always better to try than to do nothing. Some people who are choking can still breathe. They may have a look of fear or panic. Their face may be reddish and they may grab their throat, drool, or cough. Some people who are choking cannot breathe at all because their airway is completely blocked or obstructed. They may not be able to speak at all. Their face may be grayish, blue, or very pale. Or they may grab their throat and may make a high-pitched noise. So you can see here how it presents differently with a different person, but these are all the things to look for. Next, we have what we call choking red flags. And we're going to learn a little bit more about what that means here. Red flags on the next slide are listed. These are just some of them. They are alerts of high risk factors for choking with people with IDD. If someone has a red flag alert, you should pay attention. This is just a good list here to look at if they're difficult or impaired swallowing, if they have tongue dysfunction, missing teeth. We have some people who have cleft palate or high palate. You can always look at people with different kinds of facial muscle issues, hypotonia or dystonia, which means just decreased tone in their muscle. You have different syndromes such as Down syndrome, Prader-Willi, pica, the rumination disorder. People have had a history of aspiration pneumonia or stroke, or also anyone who's had a previous choking event. All of these are red flags. Next. So we will go and talk a little bit more about this word dysphagia. It's a medical term for the difficulty in swallowing. It can range from mild discomfort to not being able to swallow at all. Dysphagia affects someone's ability to move food or liquid from their mouth through the esophagus to their stomach. Dysphagia is the single greatest choking risk factor in adults. Then people with IDD and dysphagia are at very high risk of choking. It gets worse as people age and should be monitored by speech language pathologists or SLPs at least every 3 to 5 years, at a minimum. As we learn about the other red flag alerts, we want you to keep in mind that they are all just clues that the person is having dysphagia. And those are things that we then move on to the next slide. You can see with individuals having these symptoms, this picture demonstrates, choking during or after swallowing, coughing or vomiting up food, having a weak, soft voice. They're just getting food and liquid into their lungs, which is called aspiration. Some have excessive swallowing or drooling. People with cerebral palsy, you'll see that very often in different kinds of syndromes. Someone having difficulty chewing or difficulty moving food to the back of their mouth. Foods get stuck in their throat or in the side of their mouth. So these are all some signs and symptoms of dysphagia. Next, most people can move their tongue up and down and side to side. People with tongue dysfunction cannot move or control food in their mouth, leading to unchewed food, which increases their choking risk. Tongue dysfunction is a visible sign of dysphagia and is a red flag alert. Caregivers should also watch for signs and symptoms of tongue dysfunction, which might not be as clear at first, but if they have an inability to lick food from around their mouth, if the food is falling out of their mouth, if someone is, protruding their tongue often and have an inability to stick their tongue out. So all of these are things to watch for. People who have poor speech, that can also be an indication. If they cannot move their tongue left to right, up or down, as shown here. So we see just having someone trying to do it ourselves, you can see how difficult it would be for affecting the swallow. Next, missing teeth is also another red flag for choking. Loose, decayed, or missing teeth affects someone's ability to chew, grind, chop, and form food into a mass called a bolus for swallowing, and is another clue that someone has difficulty swallowing. So we want to be alert when someone goes to the dentist, to be aware if they have missing teeth and how that puts them at increased risk. Next, we've talked a little bit about syndromes and people who have cleft palate. Cleft palate and high palate are mouth abnormalities we are shown in these pictures of people who are born with this, just not really defect, it's just a difference in their palate. They impair swallowing, chewing, and sucking. And of course, we call them another red flag alert for choking. High narrow palates are seen in many IDD syndromes. Food can become trapped in the palate while eating and can then fall down, in the back of their throat, blocking their airway when the person is, even sitting, or more so when they're lying down in bed. So cleft palate, cleft lip, high palate are all visible signs of dysphagia. And of course, we refer to those again as red flags. Next. On the next slide, we see that some people have weak muscles in their face or uncontrolled facial movements. Weak facial muscles, also called facial hypotonia, and uncontrolled facial movements are called facial dystonia, are more clues that someone has difficulty swallowing and is at risk for choking. So if someone does not have a good muscle control in the area of the face or mouth, it's likely that they have a lack of muscle control when chewing and swallowing as well. So here the signs and symptoms might include weakened jaw and face muscles, repetitive uncontrolled face and jaw movement, uneven or drooping facial expression. They could have an inability to hold their mouth closed. You could see increased drooling, tongue protrusion, chewing with the mouth open. All of those symptoms are things that would give you clues. Next slide. Any DD-related diagnosis can increase choking risk. Here we have a list of some of them. However, individuals with Down syndrome, they lack tongue control, and frequently have an underdeveloped jaw, leading to impaired chewing and ability to use their tongue thrust to assist during swallowing. So due to this, individuals with Down syndrome are at an exceptionally higher risk for choking when compared to other genetic disorders. Much like individuals with Down syndrome, individuals with Prader-Willi, another syndrome, are extremely at high risk for choking due to their poor oral motor coordination. They often have a poor gag reflex. They have the hypotonia or poor muscle tone, the polyphagia or hyperphagia. So the excessive eating, the excessive hunger, it says 6 to 8% of people with Prader-Willi die from choking. So those are some very concerning things to know about these syndromes. Next slide. We have other things such as pica and rumination disorders. These are two conditions that put someone at high risk for choking because people with pica crave non-food items like chalk, clay, laundry detergent. If you know of anyone, you'll see them seeking out and putting non-food items in their mouth, putting someone at a high risk for choking. Some people with pica may need to wear a special helmet to keep them safe, and this would require a doctor's order and approval from Human Rights. People who have rumination disorder involuntarily regurgitate food from the stomach into the mouth, where it is re-chewed and re-swallowed. So signs and symptoms, include the regurgitation, the spitting out of food. It can become an issue for malnutrition, weight loss, gagging, and tooth decay. So we're very concerned about these red flags for different reasons besides just a difficulty swallowing. Next slide. There's other medical conditions. We have some respiratory infections, stroke, and dehydration are just some examples of medical conditions which are red flag alerts for choking. Aspiration pneumonia happens when people inhale food, liquid, or saliva into their lungs. This can happen silently, meaning the person may not experience any coughing or strangling when eating or drinking. The person may also have repetitive or chronic bouts of pneumonia. Consider how many times an individual has had or any diagnosis of pneumonia in the last year. You want to also think about how many times the individual has had a diagnosis of pneumonia in the last 5 years. Chronic pneumonia may mean the individual is experiencing silent aspiration. Another red flag for choking risk is a diagnosis of stroke. The incidence of dysphagia occurs in 40 to 70% of individuals who have experienced an acute stroke. So although dysphagia improves, the most stroke victims, 10 to 30%, continue to experience dysphagia with aspiration. Any diagnosis of dysphagia significantly elevates choking risk and post-stroke dysphagia. So another red flag for choking, besides this, is the risk of repeated bouts of dehydration. As mentioned previously, when someone is trying to swallow but is having difficulty, drinking can become very scary. When they attempt to drink something, the person may feel as though they are drowning, but may be unable to describe what they're feeling. They may have a look of panic on their face. They may say that they are not thirsty due to these feelings. Those receiving assistance with eating or drinking may turn their heads when someone offers food or drink. So due to this, the individual may also experience weight loss in addition to the dehydration. dehydration may be one of the earliest signs that a person has dysphagia and that their dysphagia has worsened. So some things are very
All right.
direct, but in this
Oops.
case, it could be a very indirect sign. So on the next slide, we see the universal sign for choking. People with IDD who die from choking typically have already had at least one previous event. Next slide. We're going to just take a moment for a checkpoint. For these checkpoints, if you would just put your responses in the chat, would be good. And there are many symptoms, but we'd like you to, list 3 signs or symptoms of dysphagia. Do we have some going into the chat?
Not seeing any yet. There we go. Yes, we have several going in. Can you see those, Christine?
Yes.
Okay, perfect.
So many right answers for that. And of course, someone just, put in dehydration. This last one, loose teeth, stroke. Yes, all of those are things to watch for. All right, we'll move on to one more quick check. What are 3 visible signs or red flags someone may have that indicates dysphagia? So there's the choking risks, but this is more specific to this word dysphagia, swallowing, that people are having swallowing problems. Okay. All right, thank you. Yes. Some of
Yes,
them there,
they've
they're
got some
choking.
great ones. Yes.
Yeah, they're
Teeth
coughing.
missing, choking, Down syndrome, having pica.
And then coughing when
Palate.
eating.
Yes. Mm-hmm.
All right, thank you. So now we're going to just look at some other risk factors for choking. On the next slide, we see that certain behaviors, certain brain dysfunctions can cause a risk of choking, such as you can see here, too much food in the mouth with each bite, eating and drinking too quickly, being distracted while eating and drinking, moving around and fidgeting while eating and drinking, talking while eating and drinking, laughing or playing while eating and drinking. These are behaviors that we have to be sensitive to. The people with modified diets taking food from someone else's plate, or just eating in isolation, not being out and about where other people can observe the person. Isolation always increases a risk of choking because when someone is choking, they're unlikely to be able to seek help for themselves. So these are some of the behavioral things that you would want to consider in someone's plan. Next slide. We also have to look at all the medications that people are taking. This is just a small list of them. Some medications affect the muscles used, for sipping, chewing, and swallowing. Other medications can cause dry mouth and make it difficult to swallow. And of course, these examples of medication classes that have side effects for swallowing, are shown here on the table. There might be other classes, but these are the major ones. Your job, though, is to observe and report changes in someone's ability to sip, chew, and swallow, and report to the primary doctor or the speech language pathologist, so that it's important for someone to know what medication someone is taking to really fully assess their risk. Next slide. So in addition to behavior and medication, there's certain types of food that put people at risk for choking. Some high-risk foods are listed here, and they include peanut butter, nut butter, creamy or chunky, hot dogs, corn, popcorn, got bananas, nuts, marshmallows, chicken on the bone, hard or sticky candy, whole fruits, vegetables, they're thicky, chewy bread, white bread, bagels, pizza, dry meats, ground beef here served, with sauce, without sauce or gravy, dry, crumbly foods, cornbread. So foods with two or more textures, they also can be a problem, such as, having cereal and milk together. You have two consistencies together can put people at risk. And then other things in the picture, such as olives. So people have to be observed for what kind of food they're eating, as well as the consistency of their food. Next, excuse me. Eating what we call nut butters greatly increases the choking risk. Peanut butter is one of the most difficult semi-solid foods to swallow, requiring more muscle strength and tongue coordination. So when peanut butter combines with bread, you can see how it can be very hard to move around the mouth and can get easily stuck in the back of the throat. Nut butters can get stuck on the palate and slip down the back of the mouth, blocking the airway while someone sleeps. So sometimes if we don't do, a check to make sure it's completely swallowed, it might be a delay. And when the person is, asleep, it all occurs. So people with IDD should never be eating nut butters. People with modified diets should avoid eating high-risk foods. These are some principles that we want to be aware of. On the next slide, we have an assessment tool that can help in recognizing the red alerts and the signs and symptoms of dysphagia. The screening tools can be used to identify people at risk for choking. And, one of those are on this slide, but there are several others. If signs and symptoms of high-risk factors for choking are observed, or if a screening tool shows someone is at high risk for choking, you want to seek, the medical attention, get that medical evaluation. On the next slide, we'll see a cheat sheet. We call it a cheat sheet for caregivers. It asks questions about the person's health history and when the most recent SLP evaluation was. Answering yes, to any of these questions means the person is at risk for choking and should be seen by SLP. Cheat sheets certainly provide helpful checklists to prompt follow-up with healthcare professionals. So this hopefully is a helpful tool for direct support staff to know when they observe something, how important it is to report as soon as possible. And now we'll do another quick checkpoint. On the next slide, we have a question of what are 5 foods that increase choking risk? We just mentioned several of them. Again, if you can put that in the chat.
You got peanut butter, hot dogs, fruit, nuts. Lots of great ones. Good job.
Yes, as well as
Banana.
marshmallows and raw veggies. Sometimes things like vegetables that are so good for us, we have to watch carefully with whole fruits and raw vegetables. Thank you. All right. So now we're going to move on, and I will turn it over to talk about help from healthcare professionals.
All right. Thank you, Christine. That was a lot of helpful and good information. So now we're going to talk about the different healthcare professionals who can help someone that is at risk for choking. So for any of the red flag alerts that Christine went over, a person should really be seen by their primary care provider, and that's going to be initiated because someone working with that individual has reported and seen that this person's having difficulty or has one of those red flags. So we want people to, see their PCP as soon as possible to discuss that high risk factor and request a referral from the PCP to a speech language pathologist. You want to schedule that appointment with the SLP as soon as possible and assist the person to complete any tests that the SLP may recommend. There may also be follow-up with other healthcare professionals, such as a physical therapist or an occupational therapist, to assess the person's seating position or to look at the potential of specialized equipment that may be needed during meal times to make sure that the person eats safely. So another healthcare or another professional that can also help would be a board certified behavior analyst to assist with mealtime behaviors. So just to go in a little bit greater depth about what a speech language pathologist does. They are a healthcare professional who specializes in communication and swallowing disorders. They will do several different steps to evaluate the person. They're going to look at the person's medical records. They're going to be looking for those frequent bouts of aspiration pneumonia or frequent diagnoses of pneumonia. They're going to interview the individual and also their care team. They're going to conduct assessments that looks at the face, jaw, lips, tongue, hard and soft palate, the oral pharynx, the oral mucosa, oral and facial muscles, and they're going to look at the person's ability to swallow in various positions, such as in seating or standing or with their head tilted to one side or the other. The SLP will observe the individual's head and neck control. So how well are they able to keep their head up? What is the posture, the seating posture? Do they lean to one side? Are they bent more forward? What are their oral reflexes like? Do they have any involuntary movements? They may order a test such as a video fluoroscopic swallow study. That's also known as what you may have heard of a barium, modified barium swallow or esophagram, or maybe even a cookie swallow. And that allows the SLP to actually view in real time by X-ray what goes on when someone swallows. They can actually watch the person swallow different textures of food and liquid. Ongoing care with the SLP and monitoring is very important to ensure that changes are addressed as the person ages or as their risk factors change. After the SLP assessment is completed, the SLP will make recommendations to the PCP, who then writes up the diet order modifications. So for safety, all providers are required to follow the PCP orders for diet modifications, positioning during mealtimes, and the use of any specialized equipment used during mealtimes. And that might be something as simple as a modified plate. It could be a modified spoon or fork that keeps the person from getting too big of a bite in the mouth at one time, or it could be a specialized cup. The PCP orders for diet modifications, positioning, and the use of special equipment during meal times is really important to be followed. We never should implement a modified diet without the consultation of an SLP first, and then the PCP writing up the orders for the diet modification that is recommended by the SLP. The American Speech, Language, and Hearing Association has adopted the International Dysphagia Diet Standardization Initiative, and we call it the IDDSI, as the gold standard for modified diet textures. So an SLP, even though they can write orders now in Virginia, the PCP still needs to approve the plan of care and sign that. So this is just an example of some of the resources that you might find on the IDDSI website. They use common language to describe food and food textures and drink thicknesses. The IDDSI makes it easy for caregivers to prepare modified food and liquids, ensuring the correct texture and thickness. And these are just some examples that are available on the IDDSI website. What you see at the top, a level 4 is a pureed diet. A level 5 diet is a minced and moist. And then a level 6 diet is soft and bite-sized. The IDDSI offers videos and also printable downloads that are free resources for each diet level that the framework is based on. So it's a great resource, and we always recommend that people take a look. So in addition to modifying foods, liquids can also be ordered to modify for safe swallowing. What you see are on the slide deck is just different thicknesses of liquids. A thin liquid means that nothing has been added to the liquid. An example of that would be water or tea, coffee, or soda are all examples of thin liquids. Nectar or syrup thick. An example of that would be tomato juice consistency. The liquid runs freely if it's on a spoon, but it does leave a coating behind. Honey or custard thick liquids. The liquid can be poured, but it's very slow, as you can see in the middle picture. It slowly drips in dollops or blobs off of the spoon. And then also at the bottom picture, you see pudding thick. Liquids are spoonable, but when the spoon is upright, the liquid will not stay. It sits on the spoon and does not flow off readily. So it's time for a checkpoint. So let's see what you've learned. Christine, I'll let you man the chat box. The question is, name 2 parts of an SLP assessment. Are there any answers going in the chat box?
They've got barium swallow, watching the posture, looking at mouth, assessing for choking, review of medical history, assessment of jaw, lips, and mouth.
Okay, so some
All
good
great
answers.
answers.
Yeah.
Yes.
So an SLP is going to definitely review those medical records. They're going to interview the person and their care team. They're going to look at the assessment of the face, jaw, lips, tongue, the oral pharynx. They're going to do a functional assessment of the muscles and structures used in swallowing. And they're going to look for, head and neck control, posture. They're going to look for those oral reflexes, tongue movement, and involuntary movements as well. All right, here's another question. What is one swallow test an SLP may order? We talked about this, and it has various names that you may be familiar with.
Barium swallow cookie test. It is called that as well. Yes, they've got it.
Great. That's also the official name is called a video fluoroscopic swallow study, or VFSS. But you're exactly right. A modified barium swallow, esophagram, or a cookie swallow. Great job. So just to give you a little bit more idea of what different combinations of modified textures look like. So pictured here is a ground, minced, and moist diet with honey thick liquids. So you can see the food is not pureed. There's still some chunks to the food. But the liquid, again, is that honey thick, so it's going to be very slow in dripping off of a spoon. Now, this is a pureed diet. As you can see, a pureed diet is very smooth. There are no lumps. There's no, it's just a very smooth texture. And then you have the pudding thick liquid. So it stays on the spoon even though the spoon is tilted up. And then our last example is a soft chopped, small bite size diet with nectar thick liquids. Now, a lot of times you will see that on the IDDSI, when they're talking about modifying meats, a lot of times meats are not dry. They're going to have some type of gravy or liquid to help moisten the meat. Again, this liquid is a nectar thick liquid. So although it flows off of the spoon, it's doing so at a very slow rate. All right. So we're going to take just a little bit of a break here, give you time to acclimate. And Jamie, if you can tell us what time we'll be back, and we'll start the next half of the training.
Yeah, let's just do maybe 4 minutes. Let's come back at 9:50. That way we
sounds
can keep
great.
rolling. So 9:50, and we will keep it recording, but we'll just be back at 9:50 to move forward. Thank you. Okay, Melissa, it's 9:50, so if we want to go ahead and get resumed.
All right, thank you. All right, so let me introduce Roxanne Lawrence. She is the RNCC located in Region 4. And Roxanne, I'm going to turn it over to you to continue.
Thank you so much, Melissa. All right, we're going to pick it up with the caregiver actions. We discussed how to recognize the risk factors for choking and the healthcare professionals who can help reduce that risk. So now we're going to take a look at what you can do when someone is choking. The protocols, one outcome of a treatment team, the individual caregivers, PCP, SLP, PTOT, BC, BA, ABCD, EFG, etc. Collaboration is the development of a person-centered protocol to support someone during mealtime. Knowing where to find the protocol and then following it is a big part of your responsibility in keeping someone at risk for choking safe during meals. The protocol examples include the following: precautions for pica, line of sight and verbal reminders during meals. Make sure they take one bite at a time. Techniques for safe eating. Sometimes they have special equipment. Modified diet textures, aspiration precautions such as positioning, hands-on assistance from staff. When caregivers follow these protocols, the person receives consistent and person-centered care. Next slide. Caregivers must also respect the person's right to autonomy if it conflicts with the protocol. This is why it's important for the protocols to be developed by all members of the treatment team, especially the person who receives services. It's critical to respect the person's autonomy and desire to live their life as they choose instead of prioritizing the avoidance of all the potential risk. All health-related protocols must meet human rights guidelines and require signed approval from a healthcare professional. Denying someone access to certain foods and drinks violates their rights. This requires a plan and approval from the local Human Rights Committee, the LHRC. If you have questions about dignity of risk or human rights, you can contact DBHDS Human Rights Advocate. Next slide. To reducing choking risk, these are the do's and don'ts. In addition to following the protocols, caretakers can take certain actions and avoid certain actions to reduce choking risk. Caregivers should do the following during mealtime. Encourage the person to sit up straight while eating. Encourage the person to sit up at least 30 minutes after eating or drinking. Provide meals as ordered by the healthcare provider, which means you don't stray from the order. Be familiar with person's protocol and person-centered plan. Stay current on first aid and CPR training. Caregivers should not rush the meals, even if you have something to do or somewhere to go. Plan other activities during meals. That will be a distraction. Provide food, liquids that are difficult for someone to swallow, meaning outside of their protocol. Start meal times if someone is sleepy, angry, anxious, upset, or unable to sit still. Another distraction. Provide foods, liquids that someone just choked on. That we do not want to do. Um, if you have further questions, what not to do is also on page 13 in our OIH Choking Health and Safety Alert 2020. Next slide. If someone is choking, caregivers need to be prepared to respond. Be sure you have a current certification in first aid and CPR. Practice emergency drills, increase muscle memory during a choking emergency. All caregivers should be prepared to respond to a choking emergency on day one, providing support to the person. Display posters and emergency response instructions in areas where caregivers can see them. That way everyone is ready in the time of emergency. Next slide. Now we will have briefly review how to respond to a choking emergency. This is a general overview only. Be sure to follow your first aid training and your organization's policy and procedures. Someone is choking if they have the following signs and symptoms: a weak or no cough, high-pitched squeaking noises or no sound, If they are pale or have blue skin color, they're unable to cough, speak, or cry. They look panicked, confused, or surprised. They're holding throat with their hands. Next slide. The holding throat with their hands, when someone that is the universal sign for choking. All people with IDD should be taught the universal sign for choking to the best of their ability. If someone is unable to physically or cognitively perform the universal sign of choking, speak with PT, OT, or speech about alternate communication methods and devices. Next. Next slide. Position yourself to the side and slightly behind the choking person. Lock the brakes if the person's in a wheelchair, which technically they should already be locked. Give 5 back blows and then 5 abdominal thrust or chest thrust. Continue giving 5 back blows and 5 abdominal thrusts until they can cough, cry, speak, or they become unresponsive. If they become unresponsive, lower them to a firm, flat surface and begin CPR, starting with chest compressions. After each set of compressions and before attempting breaths, open the person's mouth, look for an object. If you see an object, remove it with your finger. Never do a finger sweep unless you actually see an object. Remember to follow agency trainings. These instructions meant to take place, are not meant to take place of an in-person training. Next slide. Now we're going to put it all together. We have a case study and we'll read and then have a few questions after that. Okay. Haley is 22 years old and is diagnosed with mild intellectual disabilities, Prader-Willi syndrome, and obesity. She has a history of several tooth extractions due to poor oral hygiene when she was younger. Haley does not have a history of choking. And other than putting too much food in her mouth and eating quickly sometimes, no one knows Haley to have difficulty chewing or swallowing. She's eating lunch with her housemates in her group home, and you are sitting at the dining table with everyone. Lunch today consists of peanut butter and jelly sandwiches on white bread, veggie straws, apple slices, and carrot sticks. Just reading that. What red flag alerts do you notice in this situation? Next. Take a moment and you can reply in the chat. Raw veggies, good. Carrot sticks, good. Peanut butter, good. Now, those are a lot of the food items, good. Do you see any red flag alerts? Good, good. Brady, I see the Brady Willie syndrome, good. Yes, Haley has ID, Prader-Willi, and missing teeth. The next question was, which foods do you see for high-risk choking? And I see that you've mentioned all of them. Very good, very good. Next slide. Haley's person-centered plan states that staff should support Haley during mealtime by reminding her to take small bites, chew, and swallow before taking the next bite. Everyone is going to see a movie this afternoon, and you notice Haley is taking large bites of her sandwich immediately following with apple slices and carrot sticks. You reassure Haley that there's plenty of time to eat before going to the movie and remind her to take small bites of her sandwich and chew and swallow before the next bite. What risky eating behaviors are Haley engaging in? What is she doing that she should not be doing? Very good. Taking big bites, eating too fast. Yes, stuffing. Yes. Next. You are all correct. She's taking large bites, eating quickly, and feeling rushed. What did you do to support her? How did you know to do it? In this scenario, what did they do? Yes, tell her to slow down. Remind her of her plan. Very good. Yes. Very good. They also reassured her it's not necessary to rush, reminded her to take small bites, slow down because her plan supports. Very good. Very good. Next slide. Haley nods her head and then suddenly coughs. Her face turns red, and you see she's trying to cough, but now she can't. You ask her if she's okay, and she can't answer you. She looks panicked. What should you do? What are we doing at this point? First aid for choking, call 911. Very good. Yell for help from your coworker. Tell them to call 911. Confirm signs and symptoms of choking, the weak or no cough, high-pitched squeaking, noises or no sound, her skin color, unable to cough, which she was, speak or cry. She looked panicked, confused, surprised, holding hands on throat. Immediately begin caring for the choking according to your first aid training is what we should do. Very good, very good. CPR for choking. Now CPR we wouldn't do just yet because she's not unresponsive. Okay. After the 5 backflows, you see she's still choking. When you go to give her abdominal thrust, your arms will not reach around her waist above her navel. So you move your arms higher, like you learned in first aid training, and begin giving her chest thrust. After the 3rd thrust, you hear Haley's cough and a wad of peanut butter sandwiches falls from her mouth. You help Haley sit down and she reaches for her plate. What should you do now? She's still trying to eat after she just choked. Redirect, okay. Remove her plate. Very good. Assist Haley to sit in the living room or clear the table while explaining to her that it's not safe to eat and drink right now since she just choked. Good, good. When you remove the plate, you have to explain, yes. Okay, next. Emergency Medical Services, EMS, arrives at the home and checks on Haley. They do not feel she needs to go to the emergency department at this time. They recommend she wait an hour before having anything else to eat or drink. What should you do now? She's sitting in the living room. EMS says she's good. Monitor her. Very good. Keep the food away. Hmm. All good answers. Okay, we should also notify the supervisor and document the choking event according to the agency policies. Good, good. Next slide. The supervisor notified Haley's legal guardian, which is her mother, and the case manager and scheduled an appointment for Haley to see her PCP in 2 days. What can you do to support Haley during meal times and reduce her risk of choking during the next 2 days? Encourage her to take her time. Very good. Yes, explain to Haley why it's important to avoid eating peanut butter sandwiches and raw vegetables until she sees the doctor. Help her find other options and continue to sit with her during mealtime, reminding her slow down and take small bites. Very good. Your supervisor ask you to take Haley to the PCP appointment and ask for referral to the SLP. What do you expect the SLP to do? Good. Swallow test. Perfect. Complete a swallowing evaluation, which may involve tests like a barium swallow study, and make recommendations for diet modifications to the PCP. Next. Review medical record. All these are good answers. Posture for her tongue tone. Oh, nice. The cookie test. Very good. Very good. Based on the results of the swallow study, the SLP recommends a soft, bite-sized diet modification, IDDSI level 6. For Haley, which the PCP orders. During the treatment team meeting to update the plan with the support coordinator, Haley's mom, her legal guardian, and your supervisor, Haley tells everyone that she does not want to have her food chopped up like a baby. Are there ways to respect Haley's autonomy while promoting her safety? What can we do so she feels like she's not being treated as a baby? Teach her how to cut her food up herself. Very good. Nice. Explore and validate Haley's feelings about modified texture diets. Present it as an opportunity for Haley to become more independent, which y'all are saying. Help show her how to do it, learning cutting the food up and make it a better taste, even by adding sauces or condiments to it. Good. Next. Haley and her mom decide they want to follow the PCP orders for a soft, bite-sized, modified diet, and they want staff to support Haley by reminding her to cut up her food and add sauces before eating it. Staff will continue to sit with Haley while she eats and provide reminders to take small bites, chew, and swallow before taking another bite. When Haley goes out to eat with her housemates or goes to church potlucks, staff will assist her to identify foods that meet her diet modification orders. But Haley and her mother agree that if she becomes embarrassed or does not want to follow the diet modifications while she's out, she doesn't have to. That's giving her that autonomy. Based on this meeting, the nurse develops the following mealtime protocol. It's signed by the PCP and included in the person-centered plan. Next. So this is her meal plan. The diagnoses are listed: her Prader-Willi, obesity, mild ID, dysphagia, history of choking because of her episode. The description: when Haley choked on peanut butter sandwich, her face turned red and she looked panicked. So she doesn't do the universal signature, but the universal sign, but this is what she did. What we are to do is the staff will sit with Haley from beginning to end of the meal. Staff must be certified in first aid and CPR and must participate in choking practice drills. Staff will assist Haley with verbal prompts or physically help to cut up her food and ensure moistened according to her diet orders. Staff will assist Haley to avoid foods that are high risk for choking. Staff will assist to identify foods that meet her diet modifications while she's eating out. If she refuses the orders while eating out, staff will prompt her one more time. If she continues to refuse, the staff will sit with her while she's eating and monitor for choking. Staff will provide verbal reminders to take small bites, chew, and swallow before taking another bite. Medical attention: if Haley is choking, staff will tell someone, call 911, and will provide first aid choking until airway is clear or she becomes unresponsive. If she becomes unresponsive, lower her to the ground, begin chest compressions. Continue CPR until EMS arrives or Haley can breathe and is responsive, at which time she's to be placed in the recovery position. If an object is in her mouth, seen in her mouth, it can be removed with the finger sweep. Remember, we do not sweep if we do not see a piece of food. Next. What follow-up actions can you take to support Haley in safe eating? What can we do afterwards? Following up, what should we do? I don't see anything. Sitting with her while she eats, monitor. Very good. Constant reminders. Encouraging. That's a big one. Talk to her about safe eating. Very good. Next, you can assist her and her PC with her PCP appointments, monitor and immediately report changes noticed while she's eating. Assist her with her SLP appointments. Teach her the universal sign for choking. Next. DBHDS resources. We're going to play not a little game, but we're going to do a little fun right now. We're going to have an OIH scavenger hunt. Next slide. If you are participating on a laptop or computer, you should be able to use your phone to do this. Unfortunately, if you are using a phone, you won't be able to take a picture of the barcode because we'll lose you in the chat. But if everyone can scan that has a laptop and can scan with their phone, the QR code on the slide, and we can begin our scavenger hunt. Kind of put in the chat to let me know if you're able to scan, just so we can have someone, make sure that we have someone that can participate. Okay. Very good, very good. All right, we have people that are going in. Not able to scan. Got one on the phone. Okay, yes. Unfortunately, if you're on your phone, you won't be able to scan the QR code this time, but maybe afterwards you could take a picture so you're able to go back in and follow up on the OIH website and participate afterwards. Okay, so while you're in there, what are topics of the April 2023 and May 2023 health and safety alerts? Choking, pike up, excellent. That is correct, choking and pike up. What are the topics of the April 2023 and May 2023 newsletter? Choking, yes, among IDD and pica. Yes. Name 5 educational resources related to choking on the OIH website. And you see choking, Annual exams, training, okay, choking training activity. Dehydration, risk amount, resource list. Okay. Should be choking, health and safety alerts, nut butters, health and safety alert, choking training activity, the regional SLP list, good. Common medical emergency scenarios. Excellent. What is the contact email for the community nursing team? What's the contact email for the community nursing team? Anyone see it? Community nursing team. Just no.
Hey, Roxanne, during the in-person trainings, this one we gave a little bit more guidance because it's a little bit harder to find. It's under the dental MRE nursing. It's the blue tab. And if you click on that tab, then you go
Yolanda
down a
got
little
it.
further and click on community nursing and interdisciplinary team, and it should be under there. So that one had a few more steps with it, Roxanne, sorry.
No problem. I'd say they have it. Community nursing at dbhds.virginia.gov. That is correct. We had a few of them in there. They got it. All right. Any questions?
And just a reminder, if you do have questions, please just put those in the chat. We will gather those. We will pull all those together. We will provide responses and we will get that back out to everyone. So please put those in the chat. And Roxanne, is there anything else from your end at this point?
This is all on my end.
Okay, then I will go ahead. We do have a link that I'm going to put in the chat, and this is for our post-training survey. And this is what we would like to do. We're going to put it, I'm going to put that link in the chat now. And if everyone could go into the link, we're done early. So if everyone could go in, click on this link, it'll take you to Microsoft Forms, and this is for our post-training survey. Once you have completed the post-training survey, I'll have your name and your email. So once that survey is completed and submitted, I will then go in and we'll get that information and make a certificate for you, and you will receive that through email. As far as the training, the recording will be posted online. A PowerPoint will also be posted online, and there will also be other resources, and we will be emailing everyone who participated out about that information to let you know where that is. And Melissa or Tammy or anyone else, am I missing anything else that we need to say before we wrap up?
No, thank you for participating with OIH today in the choking training. And you can use that community nursing email address if you have questions, or if you think that your agency would benefit from additional training on the topic of choking in individuals with IDD. Just reach out.
Yeah, and we will be gathering up all the questions and putting out a Q&A resource for everyone. So everyone will get all the questions and all the answers.
All right, then once you have finished the post-training survey, then that is all. We will go ahead and stop recording now, but we will hang on and give you guys time to go ahead and put your questions in the chat. So thank you all very much.